passed. Well, the number that Washington has been waiting for all week is in, 829. It's a number that moves a health care reform plan much closer to being passed. Lizzie O'Leary has the latest from Capitol Hill. Lizzie.
About $829 billion. That's the price tag on a reworked bill from the Senate Finance Committee. It's been very important. Everyone up here on Capitol Hill has been waiting for this number all week. Here's why it's important. It gives us the overall price tag, but it also tells us about how healthcare stacks up against the deficit picture. And right now, the Congressional Budget Office, which generates these numbers, evaluates that this bill will actually cut the deficit by about $81 billion over the course of 10 years. Now, this whole thing is critical because President Obama said he would not sign a bill that comes in over $900 billion or adds one dime to the federal deficit. Very important to get these numbers. Now, this bill is aimed at increasing coverage. We know the coverage number is going to come in at about 94% of Americans over 10 years. Currently, only about 83% of Americans have health insurance. So here's what the bill does, just to give you a little bit more context. It requires that insurance companies will provide coverage. There is an individual mandate in this bill. People have got to buy coverage. Insurance companies like that. It also, though, says that insurance companies can't drop people because of pre-existing conditions. It taxes high-end or Cadillac healthcare plans to generate some of the revenue here. Now, here's a very important thing to watch in the negotiations between industry and politicians. Initially, the industry struck a deal with the White House that essentially aimed for about 97% of coverage level, would also expand their pool of customers dramatically, provide federal subsidies for people to buy coverage. But this bill comes in a little bit lower, 94%. So that gap creates some wiggle room. There's another gap as well. That's political. That's what we're going to see in the next day. Olympia Snowe, Maine Republican, she's got to make up her mind. She's the critical vote. So she's going to look at that $829 billion number today and decide whether she's for this bill or against it.